Hey everybody, how's it going? So today I'd like to discuss the way USA Today is framing the COVID vaccine and potential COVID vaccine side effects. And I really like to talk about how you properly sell people versus how you improperly sell people, and how you really should kind of try to be understanding of their concerns if you want to be successful as a salesman. And I say salesman because this article, they're really trying to sell you on not caring about some of the adverse effects of these vaccines. To be clear, 100% clear, I am pro-vaccine. I was vaccinated myself for many different things, and I will vaccinate my children if I do have children. I know people in countries where they don't have broad access to vaccines, and really, if you hear the stories, then it's kind of, it bursts a bubble that you're in living in a first world country where you don't see people suffering from diseases and viruses that we defeated 60 to 80 years ago. But that being said, I think there is a way to sell people on something, and there is a wrong way to sell people on something. So let's just take, for instance, at the store. I don't do most of the customer phone calls anymore. Usually Shane or Hi or Kevin or Eric do those now. But when I was doing them, if I had bad news to give to someone, I wouldn't frame it in a way where they're out of their mind. I would try to frame it where they're expecting it and they know it, but here are the options. So if something's going to take a long period of time and cost a lot of money, I'm not going to say, here's the price, here's the time frame, and then when they say, well, that seems a little long or too expensive, and they say, well, no, it's not. You just think that. What I would do is I would try to frame it like this. There's really no good solution for you. I have 3 solutions and they all suck. Would you like to hear them? Sure. Okay, behind door number 1, I can give this back to you as a partial fix. You probably won't have a microphone or a camera. Usually this is an easy thing to figure out. On yours, I can't figure out why it is the case. I could give it back to you as soon as tomorrow so that you can be back to work and doing everything you usually do. I just can't figure out why the mic and the camera are not working. Behind door number 2, I could call this a no fix. We don't charge you, but you don't have a working machine. Or behind door number 3, I can give you a loaner computer to work with, and I can try to spend some more time to figure out why I got it to power on, but why the camera and the microphone are not working. Again, I don't know. I've never had this problem before, so this is going to be an open-ended thing. Maybe it's a week, maybe it's 2 weeks, maybe it's a month. But I can give you a computer to work on in the meantime. It's considerably crappier than the one that you have, but at least it allows you to, view your documents and everything, and I can put your data on it. So I can give them those 3 choices and acknowledge that each of those choices sucks. Each of them is worse than what they expected, but then work with them, understand that they understand that it sucks, and then we can come to a conclusion as to which is the right way to go, and they don't feel like they were being condescended. Or I could say, well, here's the option you have. It's going to cost this much. I don't know how long it's going to take. What do you think? And then when they'd say, well, that's really long. Well, actually, no, it's not really that long if you think about it. That's not really going to get people anyway. It's not going to make them happy. And that general sales principle seems to be something that is at play when discussing the coronavirus vaccine. So this is something that I'm reading here, and this honestly, this article just reads like The Onion. You have to double check your URL bar to ensure that you're not reading The Onion, and I'll tell you why as I read through the article. It says, COVID-19 vaccine trials report cases of brief facial paralysis. But that's not as scary as it sounds. See, what they're doing is they're telling me what is or isn't scary. I'm not allowed to choose for myself what I find to be scary. You're allowed to tell me that it's not scary. Americans are increasingly concerned about vaccine safety after 4 people in Pfizer BioNTech trials and 3 people in the Moderna trials developed Bell's palsy, a condition that causes temporary weakness or paralysis of the facial muscles. While it may sound scary, experts say Bell's palsy is more common and less severe than people think. Bell's palsy, also known as peripheral facial nerve palsy, can occur at any age, according to the Mayo Clinic. The exact causes are unknown, but it's believed to be the result of swelling and inflammation of the nerve that controls muscles on one side of the face or a reaction after a viral infection. Dr. Anthony Garacci, Northwell's Health Director of Neuromuscular Medicine in Great Neck, New York, says at least 2 Bell's palsy patients visit his office a month, and they always recover within several weeks. 90%, if not more, of patients who have Bell's palsy experience a mild transient weakness of the side of the face, which is completely resolved within 3 months. The majority within a month and a half, he said. It's a relatively benign condition. 90%. See, here's the thing about percentages. You take the percentage and you subtract it from 100. That's the people that don't recover. 10% are facially paralyzed for more than 3 months. But don't be scared, according to the Mayo Clinic. Symptoms of Bell's palsy may include rapid onset of mild weakness to total paralysis on one side of the face, facial droop, pain around the jaw or behind the ear, increased sensitivity to sound, headache, a loss of taste, and changes in the amount of tears and saliva produced. But Geraci says most of his patients experience mild to moderate symptoms. This could include numbness or tingling to the tongue, or maybe an off-kilter smile, or less blinking in one eye than the other. He says symptoms can be so subtle most people wouldn't even notice someone has Bell's palsy to look at them. I challenge someone to notice someone is blinking less in one eye than the other, he said. This is the part where the article goes full onion. And again, if you have bad news for someone, if you have to sell someone on something that sucks, what you do is you level with them. You start the conversation by saying, I have bad news. We have 3, 2, 4 choices. They all suck. Help me work with you to choose which one sucks the least. You acknowledge that their concerns are real. You don't tell them that someone doing this is going to be the same as someone doing this. That's ridiculous. I don't know anybody that blinks differently in one eye than the other. To be clear, if I saw that on the street, I would not make fun of them. I would not belittle them. I'm not going to treat them differently. But let's just be real here. A, if someone does that, because I've tried it with people around me, it's something that I would clearly notice. And B, it's not that common. You could just level with them. Just be honest. But don't gaslight people. Don't tell people that this is the same and just as noticeable as this, because that's bullcrap. It says here, the Mayo Clinic says common cases of Bell's palsy include herpes, chickenpox, shingles, respiratory illness, mumps, rubella, or even the flu. Geraci said most patients are treated with antivirals and make a full recovery. Again, before he said 10%, 90% recover in 3 months or less. Again, I really, really kind of want to hear about that other 10%. We'll get to the numbers of this later. Geraci notes that it is more frequent than what was recorded in the COVID-19 vaccine trial. About 40,000 Americans a year are diagnosed with it. Geraci notes that it is more frequent than what was recorded in the COVID-19 vaccine trial. 4 persons out of almost 40,000 is even less than what we would expect to see when we take 40,000 people from the street and watch them for 3 months, independent of a vaccine. He also emphasized that there were not enough cases to determine whether they were caused by the vaccine or happened coincidentally. Cases of severe or permanent Bell's palsy are extremely rare, Geraci added. In his more than 20-year career, he has seen fewer than 5 cases. He said it's important the public understands Bell's palsy is just a boogeyman side effect and shouldn't prevent someone from getting the COVID-19 vaccine. It's a cautionary tale that should not mitigate the larger good that both individuals and society are going to derive from all these vaccines, Geraci said. Here's why I cast doubt on this. If you were to say, listen, your chances of getting this are really, really, really low, yet the damage being done to society and the economy by COVID-19 is horrible. So overall, it is better overall for more people as a society that we get vaccinated than we don't. Even though there are chances of something happening, that's a case that I think absolutely could be made to the American public, and it's a case that you should make. Once you start saying things like, I challenge you to tell that someone is blinking less in one eye than the other, that undermines your entire case, because now you're not acknowledging what's just basic reality, which is that I can tell if someone's blinking less in one eye than the other. I would actually believe everything else that you had to say if you did not dismiss my concerns, if you were not trying to propagandize me. And that's what I do with my customers. I will tell them, this sucks. I have 3 choices for you. They all suck. I understand that they suck. Help me come up with, a plan so that we can go about doing the choice that sucks the least for you. And I explain it to them. I'll put it all on the table. I'm not going to tell them, no, you think this is expensive, but it's really not. It's really not. I know you think 2 to 6 months is long, but it's really not. It's really not. No, I'll be honest. It sucks. But what can we do about it? Because when you talk to people like this, you're going to wind up with large portions of the population that decide not to take the vaccine. Now, I am someone who believes in science. I am someone who believes in numbers. I am not a science denier, which is why I am more than happy to look over the data in New York City every single month to see what the stats are. So when I'm deciding whether or not I want to take this vaccine, I'm going to make that decision based on numbers and science. So I have one person on this side who's saying, oh yeah, if your face is paralyzed for a month and a half or 3 months or more, it's not a big deal. Or you're not going to even notice if someone's not blinking on one eye or the other. I don't buy that, because immediately you've lost a lot of your credibility to me. And then I look at the actual numbers. Look over here. And then what I do is on this spreadsheet from NYC Health. Again, this is not coming from some biased news site. This is not coming from Breitbart. This is not coming from Scan Plandemic. This is coming from New York City Health. I go over here to age group 25 to 34. No illness because I don't have any pre-existing conditions. I'm not ill. In the city of over 8 million people within my demographic, there have been 5 deaths. And those are a tragedy. I am truly sorry that those 5 people died. That is horrible. And I feel terrible for them and their families. Am I going to take a vaccine where the people who are pushing it out are really kind of talking to you in an onion-like manner about the concerns that people have when these are the stats? Probably not. Now, why do people have these concerns? Why are people, why is anybody concerned about a vaccine? Well, I remember going over this in an old video of mine. I love government monopolies, where I was a little bit salty about the FDA, how the FDA was dealing with 2 companies that I knew of. I was talking about one company where they kept postponing a vaccine when they didn't seem to look at any of the data, and another company where they actually admitted in their own writing, we have not gotten to this yet. I know you did everything that we asked. I know you presented us with all this evidence. We haven't read it yet, so we're not going to approve your drug yet, even though they paid millions and millions of dollars for an expedited review. Now, in that video, there were a lot of comments kind of like tearing into me about how dare I, and they need to make sure things are safe. Now, if it is a part of our culture that we want to make sure that vaccines are safe prior to them being given out, where we are culturally used to it taking 3 or 5 or 10 or 12 years for a vaccine to be approved from the time that they start development of it, wouldn't you expect people to have the slightest bit of doubt when they get something done in 8 to 9 months? My questions would be, A, what safety procedures did you bypass in order to get this out in 7 to 9 months rather than 10 years? B, if those safety procedures were bypassed, why should I feel safe taking it? C, if those safety procedures are not necessary, then why do they exist in the first place? You see, because it's really difficult to have it both ways, to say for all of these potentially life-saving treatments, no, you don't understand, they have to go through 10 years of bureaucracy because it's so important to keep you safe. But then when we come out with a vaccine that's going to be distributed to over 300 million people, no, we can't go through all that. It's so important that we need to get it out right now that we need to ignore all the safety. Because I would argue that with many of the drugs and vaccines that go through the FDA that are only going to go to a small portion of the population, that's different than something that's going to go to the entire population. If anything, a vaccine that's going to be given to everybody in America should be going through more safeties into protocols, should be going through more checks and balances, because it's going to affect a larger number of people. So when we have a vaccine being distributed that's going to affect a much larger number of people, that's when we should have less anxiety, not more. That doesn't make a lot of sense to me. And again, when I look at the way that they talk about it, when I look at the way they talk out the side of their mouth and belittle people that have any questions about stuff like facial paralysis, and when they say stuff like you probably won't even notice it, again, if you had leveled with me, I would believe it. But when you talk like that, and then I look at the numbers, and I look at the likelihood, again, 8 point something million people in New York City, within my demographic, 5 dead. You're gonna have to do a better job of your salesmanship. And I really hope they do, because I actually believe that the vaccine itself, if developed well, will be good for society. But this is not how you sell people on it. This is not how you sell people. And there are going to be large numbers of people out there that are very skeptical about taking this, and in my opinion, for good reason. Because you can't culturally indoctrinate a society into being okay with 5 to 10 years of bureaucracy for any drug or vaccine coming on the market. But then when there's something that's going to be taken by literally everybody in the United States, have something that's going to bypass years and years of testing and safety procedures, and at the same time criticize people who have any questions about it and talk to them as if they're morons. that's not going to work out well. And I was talking to a friend on his show last night. I'll link it down below. He was talking about how within the African American community and people that he knows, there are a lot of people that just don't want to take this because we have a very interesting and horrible history in our country of experimenting, doing these horrible medical experiments on minorities. And then you have a vaccine where, again, this is the type of language they're using. You're not going to get a lot of trust in those communities. And I think that listening to people's concerns and speaking to them in a different manner would be much more productive if you want this vaccine to actually get distributed. Because again, it doesn't matter if you make it free. It doesn't matter if you're able to distribute it. What really matters is, will your citizens allow doctors to put the needle in their arm for it? And if they don't, it doesn't matter what vaccine you put out. It's not going to do jack shit. That's what I think. Let me know what you think in the comments down below.